You're listening to Med School Radio, and we're looking at first aid. We are reading it to try to understand it. So the way I study first aid is by reading it out loud. But thanks for joining me, and let's try to understand contractility. Contractility of the heart. Contractility and stroke volume increase with, I'm going to talk about some examples of where you would see an increase in contractility and stroke volume as is written here in first aid. First, catecholamine stimulation via the beta-1 receptor. So think of when the calcium channels are phosphorylated, which leads to an increase in calcium entry, leading to an increase in calcium-induced calcium release and an increase in calcium storage in the sarcoplasmic reticulum. Next, regarding the catecholamine stimulation via the beta-1 receptor, think of phospholamban phosphorylation, which leads to an active calcium ATPase, which leads to an increase in calcium storage in the sarcoplasmic reticulum. Next, intracellular calcium. When this is increased, you're going to see an increase in contractility and stroke volume. Next, a decrease in extracellular sodium, which is a decreased activity of the sodium-calcium exchanger. Next, digitalis. Digitalis blocks the sodium-potassium pump, which leads to an increase in intracellular sodium, which leads to a decrease in the sodium-calcium exchanger activity, leading to an increase in intracellular calcium. So, lastly, it says here, contractility and stroke volume decrease with, and think of these, the beta-1 blockade, which is a decrease in CAMP, heart failure with systolic dysfunction, acidosis, hypoxia or hypercapnia, which is a decrease in oxygen or an increase in carbon dioxide, and non-dihydropyridine calcium channel blockers. Thank you very much.